back. This is BoomerLife on Aug14th2017.
It's you have fun, doing that it takes the fever away.
You're listening to BoomerLife on Aug14th2017. I'm Joanne Sutton. Thanks for joining us today. We're talking about Alzheimer's disease and related dementias on today's show. Maria Howard, the CEO of the Alzheimer's Society of BC, is in the studio with us. And specifically, our topic today is driving and dementia. When it's time to give up your driver's license. Maybe you'll do that willingly, maybe you won't. And maybe it's possible to actually have dementia and keep driving. It's a bit of a hot topic, and we now have help from a resident expert on the subject. We welcome our next guest, and we'll say hello to Dr. Dean Foti, who's on the phone. Dr. Dean, are you there?
I am here.
Thank you for joining us. Excellent. So what I know a little bit about you. You can probably help me out here. Dr. Foti is originally from Ontario, studied at McGill, and then took up a residency in neurology here at UBC. Dean Foti is an accredited behavioral neurologist. Would that be your official title?
Sure, yeah. Just looking at how the brain impacts behavior and vice versa.
So that would be behavioral and general neurology. Your main areas of interest, I understand, is dementia diagnosis and management. Is that correct?
That is correct.
Okay, super. So it sounds like you're the guy who can really help us clarify some of these concerns on the topic of driving and dementia. So maybe you could talk a little bit about what led you into this dementia research. Do you have a personal connection to the disease?
Well, fortunate to say I do not have a personal connection to the disease because it is a challenging disease to manage. I think it just evolves from my fascination of the link between how brain areas control behavior, emotions, and cognitive skills, and as well realizing that dementia is an evolving epidemic in our aging population. And there's very limited treatments and management strategies when I got into this field about 20-odd years ago.
Well, thank you for identifying that there are limited facilities and information. So part of your work right now revolves around assessing the research around driving safety and dementia. When should families be thinking about doing driving assessments for the person who's been diagnosed with dementia? Are there any particular warning signs that they should be looking out for?
Well, I think just a topic, as soon as somebody gets a diagnosis of a dementia problem, one really needs to start having a conversation around driving and just explaining that driving does require a number of cognitive skills, and these generally progress, cognitive problems generally progress when patients with dementia, although some very slowly and some much more quickly. So you always have to keep an eye out for changes that are happening in a family member. So I usually ask family members about things like vehicle handling, for example, wandering in the lane, difficulty with lane control, driving generally much more slowly than they used to drive, perhaps being honked at regularly by drivers, and this is a change from before. Other warning signs are things around decision-making while driving, so being very hesitant and uncertain, making left-hand turns is particularly more challenging for patients with early dementia. There may be other signs such as becoming inappropriately impatient or angry with other drivers. It's, again, a change from their previous pattern of behavior. And less significant from a driving safety perspective, but just suggesting that somebody's having more difficulty with their cognitive skills in general is obviously becoming lost, disoriented in areas that they were previously familiar with. So those are some of the things that I ask family members to pay attention to and they can look out for in their family member when they're driving.
So I'm really glad that you actually identified the issue of getting lost on a regular route they travel, getting lost in their own neighborhood. But you didn't mention anything about forgetting where you've parked your car in a parking lot. Yeah,
that's a bit of maybe less of a concern. I mean, it could be common in Alzheimer's disease, but I also have lots of people who have that just with everyday distractibility, too many things on your mind, not sure what the kids are doing. So it's not a very specific sign, the parking lot, finding a car in the parking lot. And some people are never good at that, and some people have always been good at it. So that probably is less of an issue than the lack of familiarity in driving in your environment.
Thank you for clarifying that. Dr. Foti, maybe now can you talk a little bit about how you go about addressing the capacity to drive in a patient with dementia? It seems to be, we know it's an extremely sensitive issue.
Yes, it is sensitive, and obviously, again, the beginning part starts with what we just discussed, which is asking a family member about driving abilities, but realizing that you're not always going to get a proper answer, and you often have to interview the family member separate from your patient because they may not feel comfortable discussing it in front of them. So that's one thing that I try to do, is try to speak to a family member separately. We sometimes also ask another question. We call it the grandchild's question. So particularly if there's a son or daughter present, you may ask, do you feel comfortable with your mother or father driving your children? So in other words, are they comfortable driving the grandchildren? And if they say, absolutely not, I wouldn't let them drive my children around, then you know there probably is a problem with driving. So it's another question that sometimes gets at the issue. The bottom line from how you actually assess somebody's thinking skills and how it relates to driving is that there is no single test that clearly says yes or no for driving. And that's the conclusion, is that you can't fully determine a driving capability just based on office tests unless they are in the very impaired range. So the things that we usually do, we do some standard in-office tests, particularly looking at somebody's ability to process visual information, how they see the environment, because if they can't see the environment properly, it really affects how they can react to changes, such as a child running out between cars, how they do on decision-making tasks, how they are in terms of processing information. Are they very slow in processing things? And those can all be important for driving. So with these in-office tests that we do that are relatively brief, anywhere from sort of 10 to 25 minutes in total of testing, if there's very severe concerns, particularly about their spatial abilities, we do recommend that an individual stop driving. However, in most cases, it tends to be more in the less severe range, and there's just some mild concerns raised about how they can drive. And if the family says that they're driving well and there aren't any major concerns raised, and they have some of the only milder indicators of difficulties that could lead to problems with driving, what we usually do is we make a referral to the Office of the Superintendent of Motor Vehicles, which is in Victoria, and they're the ones that do the licensing of drivers. And we recommend that they have an on-road test, something that's specifically developed for people with cognitive problems, and older patients. So it's called the Drive Able, and it's a on-road assessment where they look at how patients do. Do they handle traffic properly? Do they make proper turns? Do they control the vehicle in the lane? And they've all based it on how other seniors do it. So it's not based on somebody that's a young driver. So they understand that there are some normal changes that occur with aging with driving, but it's looking for the more dangerous things that would predict a higher risk of a problem.
Mm-hmm, that's right.
So that's kind of the commonest scenario. And we say that, we make this referral, and it's really an on-road test that will determine whether you're capable, because it's not really up to the physician in terms of cognitive and vehicle handling abilities to make that decision. And finally, if there's really no concerns raised from the in-office testing about the dangerous areas for driving, then we'll just advise that we'll take a look at this again next year. I usually try to tell families to have the discussion, and that eventually driving will be impacted, and just to prepare them for that down the road, because it does make it a little bit easier if you've already brought the topic up when you see them in follow-up.
Well, you've painted us a very clear picture here. Can you give us an example of some of the challenges that families might face in having that conversation about driving? I imagine one of them might be with the person who's received the diagnosis digging in their heels and saying, I'm not giving up my license. That.
And again, you constantly hear, doctor, I've had a perfect driving record for all my life, and I've never had an accident, and why should I give up driving? So obviously the hesitation is that patients fear losing their independence. There's often anger backlash towards their family that you brought this up and that I'm perfectly fine for driving. But you also have to realize that and explain to family members that patients are not as many patients with Alzheimer's don't have the awareness of how their functioning abilities have changed. So some patients are very good, and some patients realize that driving makes them anxious and they don't feel comfortable, and they self-restrict and then stop driving themselves. But many other family members are reluctant to bring this up because of that anxiety about the anger backlash. And, people, even though a patient can have, with dementia, can have significant short-term memory problems, they might forget what they did yesterday. There's something about removal of their driver's licenses that causes emotional response that they almost never forget when they lost their driver's license.
So, Dr. Dean Foti, is there anything else you wanted to share with us today about the work that you do and the advice that you have for someone who's entering into that conversation about should we or shouldn't we be driving? Yeah,
it's a very gray area, and I understand it's reluctant, but it's very important from a obviously societal safety and personal safety perspective, and you really want people to give their license up and before anything more severe has happened. All I can say is that I hope that these self-driving autonomous vehicles come up very soon because that will make my life a lot easier in the future when they can have Google drive them instead of giving up their license.
Instead of themselves.
Exactly.
And just one quick wrap up here. How closely do you work with the Alzheimer's Society of BC?
We share events. We have a research forum that we put on that they're always involved with. Many times the Alzheimer's Society comes to our clinic and has an information table. We make a lot of referrals to something called the First Link program, and I always hear positive things about learning about these programs like Minds in Motion and support programs. So I think it's a very close relationship our clinic has with the Alzheimer's Society, and we certainly appreciate all the work they do in the community with our patients.
You've been listening to Dr. Dean Foti, a resident expert in behavioral neurology. Thank you so much for your expertise today on dementia and driving, and of course all the work you do with the Alzheimer's Society. Thanks for being part of BoomerLife.
You're welcome.
This is BoomerLife on CL 650. I'm Joanne Sutton, joined by friends today and experts from the Alzheimer's Society of British Columbia. CEO Maria Howard is here. We're about to hear more about some fundraising efforts with the Society and a big event that's coming up in September. Stay with us on BoomerLife.
Celebrating the boomer lifestyle. This is BoomerLife on CL 650.